Orthopedic injuries, arthritis, and other degenerative conditions can really take a toll on your everyday life. But what if I told you there was a non-surgical option for those suffering from pain? With us now with more is Dr. Michael Amoroso from New Regeneration Orthopedics. Nice to have you with us, Doctor.
Great to be here, Jerry.
Tell us exactly what Regeneration Orthopedics does.
Well, people have everyday injuries. So what regenerative orthopedic medicine does is help treat common orthopedic injuries and arthritis using our own healing cells.
Okay, so your own healing cells, non-surgical.
Correct.
There's something called Regenexx. What exactly is that?
Well, Regenexx is really the world leader in this emerging field of regenerative orthopedic medicine. They have been involved in a lot of research to really push this new field forward.
Okay, so is it, we talking stem cells here? How does it work exactly?
Sure. Well, what we do in regenerative orthopedic medicine and with Regenexx is by using the body's own stem cells, platelets, or other blood products that we can inject into the damaged tissue, we can stimulate a healing response.
And how often do you have to get these kinds of treatments in order to feel relief?
Well, I mean, when we do a treatment, if it involves blood platelets, let's say we have a tendon injury and we want to do an injection, we'll treat that tendon with blood platelets. Typically look for a response somewhere between 3 and 6 weeks. If we're talking stem cells, which we typically get from the pelvis, and we concentrate the bone marrow-derived stem cells, we mix those with platelets, we inject them into damaged tissue, and that response is typically anywhere from a month to 6 months.
Okay, so who would be, let's say, the ideal candidate for this treatment, which sounds amazing?
People like you and I.
Yeah.
I mean, if you enjoy sports and you've had an orthopedic injury and you've been sidelined due to an injury or arthritis, you'd be a perfect candidate. So it's the best way to get back into doing the things you like to do in the quickest amount of time and the healthiest way.
So you mentioned me, and let's talk about my knee.
Yeah.
I've been to an orthopedic doctor several times and had injections of steroid put in, you know, over the last couple of years, and that's gotten me by. So I've been told that the next step would be replacing the knee. Are you saying that that's not necessarily the case?
I'm absolutely saying that that's not necessarily the case. Unfortunately, this current state of affairs in medicine is you go from injury, cortisone, physical therapy, and then when you can't stand it anymore, you have that joint replaced. When in reality, staying away from things like cortisone, which actually destroys our joints, it kills the cells that become cartilage. It causes a local literally dissolving inside of your joint, and focus more on techniques which we're talking about here, using our body's own natural healing ability with our blood platelets. We can continue to keep that joint healthy.
All right. Well, if you've ever wondered if stem cell or platelet therapy might be a good alternative for you or somebody you know or love, the expert team at New Regeneration Orthopedics is standing by to help you determine if Regenexx is right for you. Here's all you do. Visit newregenortho.com, or you can call the number right on your screen there, 941-357-1773 for more information. And Dr. Amoroso, thanks so much.
Thank you very much.
All right.
Pleasure.
All right. Daytime will be right back.